All right, so today we're going to start off by going through a presentation that myself, Lauren, and Nicole, who is our young person's champion, took to our Send Improvement Board back in November. This was based on feedback that we'd had from children, young people, and from the families. So the first thing that we were really keen to emphasise is the fact that everyone has mental health, and it could be depending on where you are and the time that you are. It could be good mental health could be good, or it could need some support. And we said it's very much the same as in your physical health. Sometimes you'll go through periods where your physical health is fine, and other times you need some support to maintain that. So just a little bit about the context that we're working in at the moment. So lots of research has taken place, and that's really highlighted that for a lot of people who have special educational needs and disabilities, there tends to be a higher rate of mental health needs. And one of the reports talked about the fact this was particularly the case for young adults aged 16 to 24. There's also quite a lot of evidence now to show that people that have got special educational needs also experience poorer mental health than their peers of the same age across all age ranges. I'm not going to hover on that too long because they're quite depressing statistics. So just for our sort of local context, really, we thought it would be helpful. So this is public data that's available either nationally or locally, so you could look this up for yourself. So we have a mental health 5-year forward view, and that sets out, this is a national one, sets out that at least 35% of children and young people with a diagnosable mental health condition will be accessing treatment from an NHS funded community mental health service. Somerset's current performance rate is 26.2, and the plan from our clinical commissioning group is to deliver 28.8. So that is below the 35% recommended as the minimum within the national guidance. There's 113 children and young people who have been medicated for severe mental health needs in 1920 in Somerset. And the two charts show how we compare with national statistics around our admissions to hospital for self-harming. So as you can see, Somerset has a higher rate than both national and what we call our regional and also our statistical neighbours. So if you look at all of our data sets, we are slightly higher. Mark will tell you that does not mean that we get significantly higher funding for CAMHS, which would be lovely.
Do you want me to can I comment on it? Is that okay, Ruth?
Yes, of course you can. Go for it.
So I think the key parts here are quite important, actually. So Somerset is one of the few areas that has a liaison team based within the acute trust, and there is, I think, a little bit of if you build something, they will come. So people know that it's there. But also, it also means that we code properly in Somerset when people now arrive. We've done a lot of work in Somerset to make sure that our colleagues within the emergency departments and paediatric teams are actually capturing the data a bit more robustly than previously. And I think that puts us to a degree at an advantage in that we can evidence need a little bit better in Somerset, but it puts us at a disadvantage when we're comparing to our colleagues in the national area. The other part means that because we get to know our demographic a bit more and we understand the risk that they're presenting with, we admit less people to psychiatric units as a result. So we have one of the lowest, if not the lowest, admission rates to psychiatric units now in Somerset, which is quite remarkable.
Yeah, we have, very, very low, considering if you took the two comparisons and you said we were high for admissions but low for the ones that end up in our tier 4 provisions. It's
we've currently got 0 young people in psychiatric units.
Wow. Which is good.
Yeah, really good.
Okay, so we're going to go through the Unstoppables, which is the group of young people with SEND that are a participation group for Somerset, so they share their experiences. And one of the things that they talked about was just because you can't see a young person's mental health, it doesn't mean that it's not there. And there was a lot of conversations around the failure to identify if there were needs. So they could be very low level needs, and also a lot of discussion around the fact that We do a lot of work with children with SEND to understand how to look after themselves physically, but we tend to not have conversations about how can you look after your mental health. So some of the things that they talked about was that there was a difficulty around their denial of their conditions and impairments. So a lot of them felt that things weren't being taken into consideration if they had SEND. They talked about how so in early years and primary years, they found that it was better, and then things got worse as they got older. And obviously that probably kicks in with hormones and changes as we move into the teenage years. And one of the members reported that actually they cancelled her EHCP, and that added to her feeling that her conditions and needs were being denied. They talked about the fact that mental health is not sometimes taken into consideration when decisions are made about their lives, and how, you know, one decision can have a real big impact on their mental health. So we talked about school provision, for example, that if they're put into a school provision that isn't meeting their needs, how that can impact on their mental health. They also talked about the failure to pass on information between schools and colleges, so transitions, and how that obviously is quite a stressful time for anybody. But if you've got mental health needs as well, and that information hasn't been passed on, that can be more of a challenge. And then they talked to the fact that this then can lead to them masking, looking like they're coping when they're not, internalising, and also around a lot of perception of SEND and the stigma that comes with it. So what they did tell us is that if we get it right, then it can make a really big difference to them. So what they've asked us to do is listen when they're telling us what their experiences are, giving them choices and strategies about how to support them, having good quality EHCPs that are regularly updated, and building a team around the young person that works with them and their family. So nothing that we wouldn't expect to see there, if I'm honest. Okay, and then we did the same for parents and got their views on mental health services. So we ran a survey, and this was just a real snapshot over a week, and this really mirrored everything that we're hearing through our phone lines, support groups, interactions with families. And a lot of parents were really concerned around the support for children's mental health. This is definitely a bigger area of focus since COVID, if I'm honest. And I would say that we have more phone calls now than we did pre-COVID. And what was concerning was that a lot of people didn't feel happy about the support they were getting, and they didn't know where to go for support if they needed support. So some of the common themes that came through was that there was a feeling that if you had SEND, that impacted on your ability to access support for mental health. So a lot of the time they talked around ADHD and autism in particular, that actually what they would feel were mental health needs were being classed as their SEND need. There was lots of examples given of schools seeing behaviour and not looking at what was going on behind the anxiety that was perhaps the young people. They talked about CAMHS not picking up children and then nobody else will. So they talked about how children would be referred into CAMHS. CAMHS would say they didn't meet the threshold, but then at that point, other services, instead of acknowledging that they didn't meet the CAMHS threshold, they then went, oh, well, if CAMHS won't touch them, then we can't do anything. So it was sort of had the opposite effect, if that makes sense. Yeah. There was also lots of conversations about professionals discharging families and saying, we just don't know where to send you, and just running out of options. And around if your child had difficulty engaging, so the children that we refer to that lock themselves in their room and don't want to come out, and then how do you engage with those children? So a lot of them were finding that their children were being discharged. And there were lots of private assessments going on that people had paid for. So some of the common themes that came through, you can see where support had been accessed. And what was interesting to me from this slide was that some of the what we would call earlier interventions for mental health, so support for Young Somerset, support via Big Tent, COOF, were not being accessed.
Wow.
And then we talked about the thresholds being high, GPs saying that they were referring, but there was no alternatives. And that some of the services like Young Somerset had quite long waiting lists now. So there was quite a lot of perception out there as well that you've got to get to an extreme point before you will get any support. So we asked if you could change anything about mental health support, what would you change? And a lot of it was around access, more understanding, not being judged on their SEND needs, acting early, all things that I think actually having Mark on the call, so Mark's from CAMHS, would agree actually that early intervention is really, really key and getting the right level of intervention. I don't know if there's anything you want to say, Mark.
Only that I'm going to show my age now, because I'm fortunate enough to have pre-sight of this presentation, and I have got no idea what 4Gs mean.
Yes, good question. I think that was somebody testing it and it went a bit wrong.
Right, good, okay, because there's 4Gs and
You're okay.
And I thought I'm completely out of my
maybe
depth.
It's, you know, like 4G Wi-Fi or something. I don't know. Who knows?
Yeah, honestly, I have no idea. No idea.
I think that was somebody potentially trying to get
as well.
Yeah, maybe trying to get to the next slide, so just put something in. I don't know why G is a random thing to make, but there you go.
When you next do one of these, Ruth, I'm going to do 4 Zs just so
just to confuse us, and you're going to get everybody else to do the same. So it's the biggest thing in the middle, aren't you? Yeah, I've learned how to take them out now, but there you go. Okay, so the perception really of mental health support in Somerset was that there were mental health needs and there are SEND, and the two don't mix. I think is probably the best way of putting it. And that's really interesting because actually if you talk to the teams, that's not the perception that comes across from the mental health support teams. And it's also not the recommendation in the SEND Code of Practice, which very clearly talks about social, emotional, and mental health difficulties as one of the areas of SEND.
Right.
So we then presented a check and challenge to the SIB board, as we do, and basically asked them what they were going to do about the situation. So we asked, these are the questions that we asked to our SEND board, and as part of that we're doing these listening events, and then we're going to have some workshops around SEND services. We're also looking at improving the quality of information about what mental health support is available. So you will have seen, if you've done any of the Local Offer live events this week, a lot of those have been connected to mental health support that you can access.